Good afternoon, everyone. Welcome to this webinar. My name is Amit Basole. I'm Associate Professor of Economics and Head of the Center for Sustainable Employment here at Azim Premji University. Thank you very much for joining today. We are here today to talk about some of the findings from our recently concluded Bengaluru COVID Impact Survey, which was done in the month of November 2021. We did an in-person release about the findings last week in Bangalore, and we are doing this virtual event to reach a wider audience today. Today, the format of the session is going to be that we will start with some of the initial remarks on why we did the survey, how we were able to work with the organizations that we worked with. Then we will go to the findings themselves. This will take about half an hour or so. Followed by this, there is a panel discussion that we have organized with three eminent panelists who have been doing a lot of work in this area. One is Uma Mahadevan, who is the Principal Secretary Panchayati Raj at the Government of Karnataka and was a key part of the COVID response task force here. She is currently in meetings, so hasn't joined yet, but we are hoping that she will be able to join us shortly. We have Professor Deepa Sinha also, who will be joining us, who is at Ambedkar University, and many of you will know her very important work during the COVID crisis, but also before that on food security with the Right to Food campaign and other organizations. Deepa has also recently finished a large survey on the hunger situation during the pandemic, which hopefully she will talk about. And finally, we have Prabhanand Hegde with us, who is a Senior Program Manager at the Center for Advocacy and Research, CFAR, which is one of the CSOs that we have worked with to conduct this survey. So we will have the panel discussion post the findings, and then we will also have time for Q&A at the end of the program. So please stay with us for the whole time. You can put in your questions in the live chat on YouTube, and we will pick up the questions over here during the Q&A session. So let me introduce two people who will be also part of this presentation here in the first half of the program. One is my colleague Gaurav Gupta, who was the key person who conducted the survey and who will be presenting the findings of the survey now. And the other is Mr. Manjunath, who is a key member of the Azim Premji Foundation and used to be with the field institutes before. He has extensive experience in the field. He's now part of the translations initiative in the university. And he was very instrumental in helping us work with Azim Premji philanthropic initiatives, with whom we carried out this survey, and whose support for these organizations is what we relied on in the university to conduct the survey. So this is very much a team effort between all of these sister organizations. So Manjunath will also talk a little bit now about the philanthropy and about the work that Azim Premji Foundation has been doing during the pandemic, both on the health front as well as on the livelihoods front. After Manjunath is done, I will pick up again and tell you more about the survey. Please, Manjunath.
Thanks, Amit, and good evening to everybody. I'm just going to share a few of the work that we have done in the last 2 years or so as a response to the COVID-19 pandemic. As we know, if we just go back 2 years, 2020, March, April, there was a severe lockdown that was imposed throughout the country. The pandemic was surging and people were getting affected. And we were seeing people suffering, a lot of people, particularly the vulnerable people suffering all over the country. And as we were working in education, we felt that we were morally bound to respond to this situation. So what we did around May 2020, as we saw people suffering in the districts that we worked in. We work across 7 states in India. And we started responding to the COVID-19 by providing a lot of humanitarian relief in terms of food and ration and, in the districts that we work in. And in the 7 states, we worked directly, but also in other states, we worked along with other partners. So humanitarian relief was a big exercise that we undertook along with the partners. And fundamentally, our public health system had collapsed, was not ready to face this situation. So we were thinking how we could support the public health system by working along with public spirited hospitals and public PHCs and things like that. And we did quite a lot of work in these states, and particularly in Bangalore, where we worked in with the vulnerable communities in the slums. We have 198 wards in BBMP, and in about 92 wards, we set up our teams. We worked with about 23 partners, and we went and worked in the field directly with the communities, with the PHC system, and things like that. Basically, in the first part of the work, it was essentially awareness building, breaking the myths, and we conducted the survey and found out who were the most vulnerable people, who had the comorbid conditions, because we had to support them and protect them from suffering. And we did a lot of work in terms of testing and conducting health camps, and providing essential medical medicines to these people, because they were not going to the PHCs, and it was not accessible to them, and things like that. And as we came to around June, July, the vaccination program started. And as we know, that the supplies were limited, but there was a huge demand. And even in PHCs, people who could afford, they were lining up and for getting the vaccination and things like that. And in continuation of the work that we did first 3-4 months, we set up ourselves to do support the public health system in terms of vaccination. In July 2021, basically we worked directly in 7 states and through the partner NGOs across the country. And as a unit of operation, we picked up the PHCs in the rural areas, and in urban, it was the slum settlements. And the key aspect of our work was basically collecting the data and validating it, because we didn't have proper data in the system. So extensive house-to-house surveys, conducting data, and capacity assessment of the public health system, PHCs, what they had and what they didn't have, so that we could provide the right kind of support. Program management and data centric decision, because if we were to achieve one single objective of vaccinating everybody in this population twice over, we had to have the data. And then we coordinated not only with the PHCs at the local level, but at the block, district, and even at the state level. So overall, we covered about 3,000 PHCs, and we have been able to reach about 10 crore people in this whole vaccination effort. Of course, governments was the bigger role, but we played a supplementary part. But we were able to get either vaccination to the people or people to the places where the vaccination was given. In Bangalore, particularly, we worked with 23 partners. And it is significant that these partner NGOs were working in different areas of development before they came on board on this COVID response, as a COVID response effort. And we worked in 97 wards of the 198 that are part of the BBMP. The total number of settlements was about 527, and roughly about 10 lakh population is what we reached. And more than 800 people, volunteers, healthcare workers, worked on the ground through these 2 years, providing relief, preventing deaths, preventing spread of COVID-19 in these slum settlements. And otherwise, these were the most vulnerable of the people. And initially, the public system was not able to respond or reach out to these kind of people. And as a result of this effort, today we are in a stage where we can say in these settlements, about first dose, it's almost 100%, 98 to 100%. There could be 1 or 2% because of medical condition that they have not been vaccinated. And in the second dose, we have been able to touch about 94%, which is a big achievement. And this could not have been done by any one single organization. It was a team effort that was done. And basically, it was a multi-stakeholder engagement. in terms of working with PHCs, communities, NGO partners, BBMP at different level, and also the foundation people. So basically, the main effort involved was in terms of understanding how the machinery worked, how the vaccine supplies were coming in, how it was reaching, and how to match the demand and supply and ensure that the most vulnerable of the people were covered in this whole exercise. And basically, through this effort, I think the main thing that happened resulted in was the building of the trust and confidence among the people. They didn't have that kind of a confidence initially. We have been able to prevent deaths of many people in these communities. And this was basically collaborated with the government. We worked very closely with the BBMP, other departments of the government, Ministry of Health and Family Welfare. And we also had a very strong dashboard kind of a data management through which we were able to track this entire progress of work. And these 9 NGOs, which are part of the study that has been conducted, COVID impact study, were part of this entire effort. And thanks to them, and also hundreds of volunteers that worked on the ground, the people in these settlements have been protected, have been safe, and we can say we have ensured that they also were able to face this situation, this challenge in this whole thing. So that's the summary of this work, and this survey that we conducted is the same team that were part of the larger COVID effort. Amit?
Thank you. Thanks very much, Manjanath, for that very comprehensive background. So we'll get started with the presentation of the findings. Gaurav, if you can share the slides, or maybe Shashwat, yeah. Thanks. Yeah, next slide, please. I just want to start with a sort of big picture on, why did we do such a survey, or why did this idea arise? As Manjunath mentioned, the foundation was already working extensively and intensively with a lot of vulnerable communities, not only in Bangalore, but all over. And what we thought was this was a good way to get good quality information, detailed information on livelihood impact, which is not usually possible through other means. What we mean is that our standard macroeconomic indicators that are often followed, the high frequency indicators and so on, where where the type of recovery is debated, is it V-shaped, is it K-shaped, all of these kinds of things. These indicators don't actually give us a good picture of what has happened to the informal economy, because the statistics rarely come in enough time. Secondly, there are large-scale household surveys like the Consumer Pyramid Survey, for example, of the CMI, or the Periodic Labor Force Survey, which all are better at capturing lower income groups, and some at higher frequency than others, but they don't give a very detailed picture. They are by design large-scale surveys, so they have lakhs and lakhs of households in the sample, and you can get a picture, but it's not a very granular picture that you can get. So a study that focuses purely on poor and vulnerable households is desired from that perspective. And the reason for doing this survey was precisely to get a snapshot of different points in time for the impact of the COVID-induced lockdowns and the coping mechanisms. And our key point of interest going in was, what are the persistent effects beyond the lockdowns on these communities? Because all of us know that the lockdowns were difficult for everyone, but the lockdown was not the end of the story. Neither the 2020 lockdown nor the 2021 lockdowns are the end of the story when it comes to the ongoing impact on livelihoods. And that is what this study is designed to capture. Next slide. As Manjula has mentioned, these organizations, which are mentioned here by name, the ones that we worked with for the survey, are all part of a bigger family of organizations working on COVID response. And we will hear from one of the people who is part of these organizations, Mr. Hegde, who is from CFAR, Center for Advocacy and Research. But in addition to that, there's ActionAid, there's Swabhimaan, there's Reaching Hands, there's Sangama, APSA, Hasiru Dala, Thamate. There are many organizations all over Bangalore who very kindly provided us with the volunteers who are their own full-time members who we were able to train to conduct the survey. So there were about 70 of these enumerators or field staff who went out to various different communities in all over Bangalore. If you can go to the next slide, we managed to cover all the the map is what I meant, Gaurav. Maybe you can come back to these slides. Let me just go over there and give people a sense of the spread. So we were able to cover all the major parts of Bangalore, and Gaurav will go into more details of how we sampled in these various locations. But we believe that we've managed to get a very good picture of at least the universe of people who these organizations are working with. So for those who are here, who are students and academics, the structure of the sampling is not such that we can claim to be representative of the entire city or of the entire city's urban poor, but we can certainly claim to be representative of the tens of thousands of people who are being worked with these organizations, which is also still quite a large population. And our sample is of 3,000 households, which in itself is also a large sample. So what did we find? Gaurav, sorry to make you flip, if you can go back to the main findings. I'll cover the main findings and then we'll go to the more detailed picture. First of all, we found that most of the workers that we spoke to had experienced a shock, and even in Jan-Feb 2021, which is what we were interested in. We were not interested in the lockdown of 2020. We were interested in the post-lockdown effects. So we asked them about just before the second wave hit, when things were starting to normalize, what was your situation? And they said, 41% of workers had no work in that month, and another 21% did not have the earnings that they had before COVID. So a large majority had experienced some kind of shock. Further, we said, okay, what about by the time we come to October 2021, which is when we actually conducted the survey, and which is several months after the second wave had subsided, we found that even then shocks were persistent. There was continued unemployment. So unemployment was elevated not only before the second wave, right? But even by October 2021, people were still feeling the impacts of the pandemic. So as the second bullet point or the third bullet point says, 11% of workers had not recovered from job loss. And women were even worse affected. 15% of women were unemployed as of October 2021. They were also unemployed as of Jan-Feb 2021. So they had experienced long periods of joblessness over this time. And as I also mentioned, earnings losses were also persistent. In Jan-Feb 2021, earnings were about 10% below COVID levels in nominal terms. By October 2021, earnings had recovered to pre-COVID levels in nominal terms, but in real terms, they were still below COVID. So what that effectively means is that we have about a year and a half of a real terms decline in earnings for these communities, for whom earnings are low to begin with, as you will see later. Next slide. How were the households coping with these kinds of massive job losses and income losses? We found that about 11% of households had borrowed for simply daily expenses or to repay old loans for survival. Another 12% were shut out of the credit market, meaning they wanted to borrow, they were in a bad situation, but they could not find lenders. And this was particularly bad for Muslim households and OBC households. An additional 15% had not borrowed, but they had to sell or pawn assets, overwhelmingly jewelry. Right? So taken together, about 30 to 35% of households had to resort to some sort of a distressed sale of assets or emergency borrowing. And we think that most of these are probably underestimates, because people don't generally feel comfortable revealing this kind of information. The second way in which people coped was, of course, to reduce food intake. And Deepa Sinha is here. She will talk a lot more about the findings of the hunger survey that has been done in multiple states. We find that there's a sharply increased food insecurity, which is persistent. So even in October 2021, 40% of households are telling us that they are not eating as much as they used to before COVID. Again, several months of reduced food intake. Next slide. We also did some amount of investigation of government schemes and relief and what had happened there. And we found, not surprisingly, that the PDS was the mainstay of the social safety net. 55% of the households with BPL cards had received more than the regular quantity in the months after the second lockdown. And another 32% at least sometimes got extra grain. So, well over 80% of households, BPL households, had some access to extra grain. Of course, this is the basic minimum, but it did work. The cash transfers did not have as good a record. The problem was that the national cash transfer in 2020, which relied on Jan Dhan accounts, 78% of households did not have a woman-owned Jan Dhan account at all. So they were excluded right from the beginning. And of the 22% who had Jan Dhan accounts, only a fraction had gotten the cash. So the reach of the cash transfer scheme was very limited. And of course, the amounts were also very limited. There were some improvements we found in the ICDS midday meal program, which we will talk about a little bit later on in the presentation. And then finally, the Karnataka government schemes were also fairly ineffective. We found that only 3% of our sample households reported receiving any kind of cash under specifically the state government schemes. So taken together, the cash transfer safety net has not really performed, and there is a need to look into how we can make it better. So that sort of sums up the main findings. And Gaurav will now go into a little bit into more details of how we did the sampling and what results we found on employment and earnings. Then I'll come back and finish the presentation. Gaurav.
Thank you, Amit. Before I get into the sampling and the sample characteristics, the hard work put in by our entire survey team, that's about 70 people from the CSOs that we work with, the partner organizations that we work with, our colleagues from the foundation and our colleagues within the Center for Sustainable Employment, does call for another round of thank you from my side as well. So thank you very much for making this happen. This survey happened during a very difficult time. Like Amit said, we did this survey in November, and November was a time when we had Diwali. We had the famous superstar Puneet Rajkumar who passed away on the first day of the survey. So, we had to kind of halt it on the very first day itself. And then there were untimely rains in Bangalore. So hats off to people who actually executed this survey on the ground. Okay, so just very briefly, the map that you see here on the screen basically shows the 8 zones that Bangalore is divided up into. And within these zones, Bangalore has a totally about 198 wards. So our entire survey that we conducted, that covered about 33 wards, but we made sure that there was representation from each zone. And for those who are interested in details on which particular wards we actually ended up surveying in, this is the list of 33 wards, and this will be available on our website as well, Center for Sustainable Employment's website, where we've loaded these uploaded these slide deck as well. So I won't spend a lot of time, but we'd made sure that we were there in all the 8 zones in Bangalore. Now, coming to the actual sampling procedure in terms of what was our sampling frame? We like Manjunath mentioned that we were working. The foundation was working with a lot more organizations to begin with, and depending on the on-ground coverage, the kind of data that was being collated over a period of time, and what quality of data was available, what type of data was available, and the settlement size. We did not want to go to very small settlements with 5, 10, 15 households. We came up with a purposive selection of 179 settlements. Now, these 179 settlements were our sampling frame out of a larger list to begin with of about 314 settlements totally in Bangalore that the foundation was kind of working with. Now, the sampling was actually done in 2 stages. We wanted to make sure, we from the map that I showed you, we wanted to make sure that whatever representation that there was in the sampling frame, how, whatever number of settlements were there in north, east, west, and south Bangalore, uh, we wanted to ensure the same level of participation in our sample as well, the same level of representation in our sample as well. So we randomly selected almost half of those 179 settlements from our sampling frame. We made sure that every zone had a representation, and 50% of these settlements were randomly selected. So if South Bangalore in our sampling frame was representing about 53% of total settlements, the chosen sample also had 53% settlements in the same way. In the second stage, we randomly selected 6% of the households from each settlement, also making sure that for the slightly smaller settlements above 30 but less than 80, we selected a minimum of 5 households. So totally in these 92 settlements, there were about 50,000 households to begin with, and we randomly selected 6% of households. That's about 3,000 for our survey. In the end, we ended up surveying about 2,841 households, which included a little over 10,000 individuals living in them. Of the entire sample, women represented about 50% of these individuals. Muslim households made up about 1/5 of all the households that we had surveyed. SC households made up about 37% of all the households that we surveyed. Individuals all put together with secondary or below, that's 10th grade or below level of education, they represented about 83% of our total sample. It must be noted that within this 83%, there were 22% who were also not literate and 5% who considered themselves as literate without any formal schooling. Before I get into what's on the slides in terms of living conditions, I do want to share, from my visits to these some of these settlements during the survey. The surveys, while it's a household survey, a lot of these surveys did not take place inside the house. The houses were so small, and with more people living in those houses, most of these surveys could only comfortably be done outside the house. And there were rains, and it was really difficult for our enumerators also to kind of do this survey standing outside, but they did a fantastic job out of it. Looking at a couple of key indicators in terms of how people's lives are in these settlements. Availability of water for purposes other than drinking, 1/3 of the households still rely on public provision of water, which is you through a public tap or a hand pump, etc. But what's more critical, and what kind of pained me when I was doing these field visits at the time of the survey, was that most of this water would be available at 2:30 in the morning, 2:30 a.m. or 3 o'clock in the morning. And most of this responsibility to fetch this water, it was several hundred meters away or somewhere, at one corner of the settlement. The responsibility was on the women of the household to get this water. And this was a daily ritual for almost all these households. And then the women had to get ready for work the next morning. 6% of the households still purchased water from tankers. When it came to toilet facilities, while a reasonably large proportion of the households had access to private toilets, there were also a large number of households accessing public toilets, or whether fixed or mobile toilets. But 8% of the household, even today, have no access to toilets, either private or public. Looking at what kind of assets these households had, what kind of asset ownership they came with, into the pandemic, 9 out of 10 households did not own a house and were living in rented accommodation. 3/4 of the households did not own a two-wheeler, and 44% of households did not own a basic home appliance like a refrigerator, a mixer grinder, or a washing machine. Before I get into some more details of the results of the survey, just wanted to highlight the three time periods that we kind of have referred to continuously in various slides and through this survey. So our first reference period was basically before the first wave lockdowns, a typical month in the pre-COVID period. That's the Jan-Feb of 2020. The second reference period, again, the lockdowns were not uniform, and the lockdowns happened between April, May, June. They were kind of scattered across the country. Uh, uh, but the second reference period for us, when the enumerators went and asked questions, various kinds of questions to the respondents, the second reference period was basically about the Jan to March in 2021. The third most recent reference period, the survey went live in November. The third most recent time period was October 2021. So these are the three time periods that we'll need to keep in mind when we look at the results in the next few slides. So Jan-Feb 2020, Jan to March 2021, and October 2021. Okay. Amit did talk about how the employment and income shocks were all pervasive. 62% of workers faced some sort of a shock or the other. 41% faced an employment shock, having lost their employment, and 21% experienced a drop in earnings. I'll go into some more details of how that kind of showed up. The workforce participation rate for those 15 years and older was about 42% in the pre-COVID period. I'm kind of talking about the graph on the left hand side of the screen. The blue bar there represents about 42% workforce participation rate. That dropped by about 13 percentage points uh, to be at 28.5%. And this period, the reference period, is Jan, Feb, March 2021. So that's 7 months after the removal of first wave lockdowns. The workforce participation rate was as low as 28.5%. Uh, in the most recent reference period, the yellow bar, the workforce participation rate has gone back up to 42 and a half, 40, close to 43%. But the point to note again here is that the red bar, which represents the numbers as late as Jan Feb 2021, uh, shows the kind of elongation of the painful period that people had to go through. Uh, Looking at the right hand side graph on the screen, the unemployment rate, people looking for work but unable to get it, was about 23% in the pre-COVID period. That more than doubled to 47%. And we are again talking about Jan Feb 21 as the reference period. Again, 7 months after the withdrawal of the first wave lockdowns. This has recovered by October 2021 to 22%. Looking at persistence of these effects in a slightly different manner, of all the 100 people that were working in the pre-COVID period, 11 of those 100 people lost their work, did not have work in Jan Feb 2021, and also did not have work in October 2021. So in this pie chart that you see on the screen, the portion in yellow are the people who were not affected, are the workers who were not affected. They remained employed throughout the period. The portion in blue are the people who lost work, did not have work in February, Jan Feb 21. That's the reference period that we checked with them on, but had gained it back by October 21. So they had lost some work, but had gained it back by October 21. But the portion in red is the one which signifies the pain, that 11 out of 100 workers from the pre-COVID period had not got their work back. Uh, Based on the same sort of data, we split it up into men and women. Again, the portions that we need to focus on are the ones in red in these pie charts. The one on the left is basically showing how many men workers lost work and had never recovered. Even by October 21, they did not come back to the same old situation. So that's about 10 out of every 100 men who were working in the pre-COVID period. They have not, they're in the no recovery category. But for women, this number is close to 16 out of every 100 women workers in the pre-COVID period. So they're still in the no recovery category. The income levels getting into COVID were also low. Amit, I think, mentioned about that in his summary at the start of this presentation, and these dipped even further. The average earnings, the mean earnings of a worker in the pre-COVID period was 9,400 rupees to begin with, as one entered the phase where COVID was hitting all of us. But by Jan-Feb 2021, this had almost dropped by 1,000 rupees. Already low levels, but they had dipped even further. That's about 10% reduction in earnings. While a recovery, one can see in this table right on top that by October 21, the nominal earnings have almost recovered to the pre-COVID levels. But again, like it was mentioned earlier, these are nominal earnings. They don't consider the fact that consumer price index for the urban spaces during the same period is up by about 11.5%. So in real terms, in purchasing power of money terms, people are still worse off even after 17, 18 months of persistence of COVID. And there has been obviously withdrawal of lockdowns, etc. Restrictions have been eased up. Then we also looked at what percentage of the households were below income poverty. I mean, poverty statistics looked at in a certain way, where we kind of looked at what's the minimum wage recommended by the expert committee on national minimum wage that was headed by Anup Satpathy in 2019. So the minimum wage recommended for an urban area was per day daily wage of 430 rupees. That comes to about 119 rupees per person per day. When we ran the numbers for the data that we had been able to collect from our survey, we found that pre-COVID, this percentage of households below the poverty line, as defined by this 430 rupees per day, 67%, 66%, that's about 2/3 of the households were below this poverty line. Now, in the second reference period, that's Jan-Feb 21, this had shot up to 80%. And this had, in the most recent period, it's again back to the 67% level, but I mean continues to be high. But the point is that it was much higher. It had shot up by 13-14 percentage points in when it was as late as Jan-Feb 2021. Having looked at the persistent effects on employment and earnings, we'll have a quick look at not just the fact that people lost work. There was also a lot of flux, a lot of occupation switching had happened in the labor force. So the five main occupations, before we go into what kind of movements happened occupation wise, we've seen the macro numbers. The 4-5 different occupations that contribute to almost about 60% of the workers amongst our sample. The biggest one were drivers, daily wage workers, either in construction or other industries, domestic workers, and factory workers, either in government or other industries. They almost contribute about 60% of the total the workforce pre-COVID. Now, we did not see a huge change in these numbers, the occupation structure, as far as the split between proportion of male and female changing over the 3 different time periods. So we've not shown the other 2 time periods here. What this table shows is basically what the kind of job losses and transitions that have happened by different occupations. So it's and the way this table is arranged is in the descending order of what percentage of workers in each of these sectors lost work. So one can clearly see the top three, sectors which were most impacted by the mobility restrictions, by people avoiding calling, getting work done at their homes, etc. So mall, supermarket, showroom workers, 60% of them lost work. Daily wage workers in industries other than construction, about 48% of them lost work. Tradespeople like plumbers, electricians, carpenters, painters, welders, all put together, 46% of them lost work. 14% of them moved to a different occupation. Had that not happened, there would have been more of these tradespeople losing work. We did see on an average about 40% people lost work. We did see on an average about 7% of people moving to different occupations, but there are a couple of occupations here which kind of stand out. Tradesperson did move, about 14% of them moved to other occupations. Construction workers, about 10% of them managed to find work in other occupations, and street vendors, about 11% of them managed to find work in other occupations. There is no clear-cut concentration in terms of backup sectors that we could highlight, but they've kind of moved across different sectors wherever one could find in different occupations, wherever one could find work, there has been movement. Now for the rest of the presentation, I'll request Amit to kind of take it over from here. Thank you.
Thanks, Gaurav. We'll end the presentation by talking a little bit about how households coped with these massive job losses and income losses. So next slide. As I had mentioned at the beginning when I gave a preview of the results, borrowing particularly from informal sources and selling of assets or pawning of assets were as expected what households had to resort to. So this table gives you the proportions of households that had to borrow, that either went in with debt pre-COVID, and that's the first column, had to borrow between the first and the second waves, or had to borrow after the second wave. So you can see that at each stage, we have data on who borrowed, were they able to borrow or not, and so on. So what we can see is that 17% of households went into the crisis with debt and not insignificant debt. You can see one of the rows shows you the mean loan amount and shows you 75,000 rupees. Recall that the incomes here are something like 10,000 rupees a month. So this is the mean loan amount, the going in. And then there's additional debt being acquired during the pandemic, right, which is making the situation worse. So 47,000 rupees of additional mean debt obtained or acquired, that's 12% of households that had to borrow there. Right? There is a significant proportion of households who wanted to borrow but couldn't, and that rationing predates COVID. Right? Before COVID also there are households who are unable to borrow, and during COVID that number goes up. It goes from 16% to 18 and 19%. There are nevertheless the majority who say they did not want to borrow. And that's about 70% of households. As I said earlier, it's possible that households are not ready to reveal the extent of their indebtedness, or whether they have borrowed and whether they have sold assets and so forth, partly for obvious reasons of dignity and revealing such information, etc., but also for more complicated reasons such as whether they would get future loans if they were seen to be highly indebted now, and so forth. So these numbers should be interpreted with some caution, but even as conservative numbers, they are alarming numbers. They show that a third of households had to borrow for either basic necessities, had to pawn jewelry, and so forth. And they've borrowed several times their monthly income. So we have to examine the long-term consequences of buildup of such debt. Next slide. Most of the borrowing happened for daily consumption purposes. So the biggest bar there you see, 70% said that they had borrowed for food, health, or other daily expenses. Another 23% said they did it to repay existing loans, or the remaining for things like children's school fees and so forth. Next slide. The other way in which the stress showed up was through declining food intake. Now recall that these are numbers, this pertains to the last reference period, which is October 2021. So we are asking people Are you eating the same as you were before the pandemic for these various items, meat, egg, vegetables, overall food intake, and so forth, milk. And what we find is that for almost every item, a significant proportion of households, 30% or more, say that their consumption is lower than what it was before the pandemic. And overall, the headline number we have is that about 40% of households, the red bar, say that they were eating less than they were before the pandemic. In other words, consumption was not back to normal levels. Next slide. Yeah. So the last point we would like to make is the effectiveness of the safety net or the schemes that were carried out. Next slide. The first thing that I also mentioned at the beginning was that PDS had the widest reach. So 55% of households with BPL cards said that they received more than the regular amount of grains in all the months since the second lockdown, which is how we had asked the question. We'd asked them that there is a scheme in operation. You're supposed to get more than your 5 kg entitlement. How much have you gotten in these months? And 55% said they had indeed gotten something extra. 32% said they had gotten something extra in a few months. Now I should note that the full amount, which is 10 kgs for a priority household, was actually not the norm. So most people had got something between 5 and 10 kgs, indicating that there are still problems of reach. But in terms of reaching households, this was still quite an effective scheme. Next slide, please. As opposed to PDS, cash transfer was far less effective. So as I said earlier, 78% of households did not have a woman-owned Jan Dhan account in our sample. So they are excluded right away from the 2020 Garib Kalyan Yojana cash transfer. Among the 22% who did have it, 75% of those reported that they received something. So that's about 16.5% of the total sample saying that they had got some cash at that time in 2020. And only about 9% of the total sample said that they received the full 1,500 rupees. Right? And of course, 1,500 rupees is a very small amount given the kind of shock that these households have endured. So at the national level, the cash transfers remain, the net remains quite problematic in terms of exclusion, and the amounts are also small. At the state level, the Karnataka government had announced several schemes targeted towards particular occupations, but only 3% of our households reported receiving any of these benefits. So the schemes were not really very effective, in fact, even less effective than the national one in reaching households. And in case somebody's interested in what kinds of households actually receive these 3%, who are they? There in the gray text, we have some of the occupations listed. So to sum up then, PDS and cash transfer offer a big contrast in how effective they were. Next slide. We did observe encouragingly that there were some improvements in the midday meal and ICDS coverage. There were substantive number who had not got any midday meals in both periods. That was true. But 12% reported that they got some support during COVID when in fact they had not received support before COVID. So that was something of an improvement here. And then conditional on there being a child under age of 6 or a pregnant lactating mother in the household, percentage of households who were reporting supplementary nutrition from the Anganwadi system also went up about 14 percentage points during this time. So there is some encouraging signs on the attempts that were made to reach households through these systems did work to an extent. Next slide. So just to finish up, what can we say about how to move forward? First of all, this survey again reinforces what many other surveys have shown, that livelihoods were impacted massively and for a long period of time, not just during lockdowns, but for the entire 1.5 or 2-year period, households have been under stress. The PDS has played a crucial role. MG Narega has played a big role in the rural areas. Of course, that was not part of the story here. But in this context, I'd like to point out that there are 6 states now in India that have implemented some kind of an urban employment program, which is modeled on the MG Narega. These states are Kerala, which already had a program before the pandemic, Odisha, Jharkhand, Himachal, who introduced it soon after the pandemic, and Tamil Nadu and Rajasthan, who have just introduced it. So Karnataka can definitely also think of introducing such a program, although a truly effective national program is really what is needed at this point, that can be a guarantee in the urban areas and can perform the same kind of role that NREGA performed in the rural areas. Lastly, cash transfers have not proved effective. Creative ideas are needed to reach a larger number of vulnerable households. Cash transfers cannot substitute for PDS. They cannot substitute for MG NREGA. That's very clear. But they do have a role to play, and we should think about how to widen the cash transfer net. I'll end our presentation here. We've gone a little bit over what we planned. I apologize for that. But I'll now call upon our panelists. And if you have questions about the presentation or the data or the survey, please put them on the comments box and we will get to them after the panel discussion. So as I said earlier, we have 3 panelists. I'm not sure if Uma Mahadevan has arrived yet, but in case she comes, we will have her join. Meanwhile, we have Professor Deepa Sinha from Ambedkar University and Mr. Prabhanand Hegde from CFAR, who will be starting with their interventions. Deepa, if I can call on you first to either react to what you just heard or to also maybe talk about your own findings and any other relevant issues.
Thank you. Thanks, Amit. I'd like to first congratulate and also thank the entire team from the Azim Premji University and all the partner organizations for taking on this exercise and going ahead with it. I think it's very important that we have this sort of field surveys which tell us what the situation on the ground is, particularly because one, of course, like you said, that the macro data that we have do not tell us what is happening to the lives of the poor and the vulnerable who were covered under the survey, but also that the other kind of data sources that existed, which would give us an idea of what is happening to the poor in the country, what's happening to consumption, have also kind of been diluted in the recent times. We don't have a consumption expenditure survey. We don't have any information on food security from the consumption side, really. Therefore, it's very important with the limitations, of course, of sample survey and representativeness and all that. But despite all of that, I think given the absence of any other data, even to bring out that there are a large number of people in this country whose lives have been very badly affected by this pandemic and the resulting economic crisis is itself something very important and that needs to be done. And I think this survey adds to the very few efforts that are there, which is doing this. While you were presenting and when I was seeing your PPT also, one of the things which is kind of, it is sad, but it also indicates is that many of the findings are very similar to the findings that we saw also in the Hunger Watch survey that we did. So the Right to Food campaign conducted a Hunger Watch survey with about 7,000 households across 14 states. And we did the survey in December, January 21-22. And similar questions, some differences. Our sample was even more targeted at finding the poor and the marginalized. There was really very little randomization that happened. But certain issues, I think, which come out from your survey as well as what we did, which are quite important. The first, like I said, is that the distress is not over, that it was not just during the lockdown, so just immediately, but you see it post. And again, we had a third wave also after these 2 rounds of surveys. Of course, it was much less severe, but once again, we did see localized kind of curfews, evening curfews, night curfews, weekend, and so on. So we don't know what the current situation is. But what we do see is this thing like you found that the incomes are still not back, even in nominal terms, to what they were pre-COVID. And we know that pre-COVID itself, the situation was not great, particularly for these people who are mostly earning below minimum wages, whose large proportion of their incomes are going in food consumption, and the food consumption itself is not of great quality. The other important and something that needs to be highlighted, because somewhere when you look at the mainstream media and the mainstream policy discussions, you feel that despite all these surveys coming out at different stories coming out, that there is still no general kind of acceptance in public debate that hunger and food insecurity is a problem in the country. It was even before COVID began. But like you found, again, strikingly similar figure, we also found that 41% of our respondents in the Hunger Watch survey also said that their food consumption was less than, when we did the survey, compared to the pre-pandemic period. And again, pre-pandemic, we must remember, was not great. The food consumption even then was below what a healthy diet would be. But about 40% people saying across different surveys that they're eating less than what they used to eat, even though this represents the poor, I think is quite a significant number. And we really need to think about what this means. What we did in the Hunger Watch 2 was also to include something called the Global Food Insecurity Experience Scale, which is developed by the FAO, which is a set of 8 questions asking things like did you ever have to sleep hungry in the last 30 days? Are you anxious about not having enough food? Did you go a whole day without eating food, and so on? It's an 8-point scale. And the way it's interpreted is that if the answer was yes for any of these, then there is some food insecurity. And about 79% of our respondents answered yes to at least one. So there is some amount of food insecurity. And of course, all of this is not because of the pandemic. That's the other point that you know from this, that 40% are saying it's worse than pre-pandemic. But when we ask these sort of questions, then 80% shows some kind of food insecurity. And quite shockingly, 25% what would classify as severe food insecurity, which is that of the 8 questions, they had an answer of yes for 7 or 8 questions. So incomes falling, employment, the rates might seem like it's recovered, but we know from other work that your center has done, as well as again this survey, that the recovery does not really mean at same wage levels, the number of days that work is being available. There's a big difference in what is going on, and we can see that all that is affecting people's food insecurity. Another again thing which finding which is quite similar to what we found is in the coping mechanisms, where we also saw a large proportion of our respondents saying that they are needing to borrow money to meet their basic consumption needs for food and health and so on. And also, when we asked them about future prospects, what they thought if it would improve, they were actually sadly less than a third who felt that it would get better in the next 3 months. They felt that this is how it is going to be. And also the quality of food, like you had this slide which showed the proportion of households which reduced the consumption of eggs and milk and pulses and leafy vegetables. That was also a similar kind of order that we found in the Hunger Watch. Why I'm repeating some of these is also because, I mean, again, like I said, given that using different methodologies, different sets of people, if we're finding these things, it clearly tells us some basic interventions that need to be done, and that we really need to think about when we are talking about recovery, that there is a certain set of people for whom just talking about recovery in terms of this K-shaped and V-shaped obviously does not work. And we really have to look at also direct, immediate kind of interventions and what works and doesn't work. And again, I think our surveys, both what you presented today and what we did, give us certain indications of what works and what doesn't work and what can be done. First, since we covered both rural and urban areas, our sample was about 65% rural and 35% urban. We also found that, in fact, this whole effect on livelihood and incomes was worse in urban areas than in rural areas. Usually you find the reverse, but in this COVID period, we are clearly both in Hunger Watch 1, which we did just before the second wave, and Hunger Watch 2, which we did end of 2021. Both of these showed that the vulnerability in COVID, because of these lockdowns and this kind of economic distress, in some ways was more amongst the urban poor. And our schemes and programs, which seem to be even reaching people in rural areas and helping them, like the PDS or the NREGA, are much weaker in urban areas. An employment guarantee, of course, is hardly there in urban areas. And like you mentioned, there are only few states which have now started it. And the PDS also, the coverage is much better in rural areas, and the systems of the PDS delivery are much better in rural areas. This is how the PDS itself has evolved over the years. And therefore, both of these, on targeting urban poor as well as having employment programs for urban areas, is quite an urgent kind of a need. And that should be really one of the big things that come out of this COVID experience, that we finally have a focus on urban poor and that there is some concrete kind of action towards that. In urban areas, another issue you mentioned, I think over 90% people living on rent. That's something again we found as well, a large proportion of people living on rent. And we also had a question on, I don't remember the exact number, but a large number of people who were living on rent also not being able to pay their rent. And that was one of the reasons for indebtedness as well, because that was this fixed expenditure every month, despite whatever was happening. So to quickly kind of wrap up, what are the interventions? One, of course, is urban employment and reaching even PDS even better in urban areas. We also find that those who had ration cards did get PDS, even if not the entire 10 kgs, but most of them got something during this period. But again, the proportion of people who had ration cards was lower in urban areas compared to rural areas. So how do we include more people into the PDS net in urban areas? And here there have been discussions around one nation, one ration and so on. But we find that those still work only for those who already have ration cards. What about those who are not in the list at all? This becomes even more important, I think, in the current context where we see actually inflation and it's expected, prices are expected to rise further given the global situation as well. And also another, again, very significant finding across both surveys is this issue of not being able to afford gas cylinders, which is also something that inflation is now contributing to. And if we look at the budget figures, you see that the budgets for Ujjwala and the LPG subsidy have been falling quite substantially. And so food security is not just about having the grain. Even if they get the grain from the PDS, there were many households which said that there were days when they could not cook because they could not fill their gas cylinders because of the prices. Midday meal and ICDS, again, programs which yes, perform below par during the COVID, but now with schools and Anganwadi centers reopening and this food being available, this can be a very useful mechanism to reach out to the really vulnerable sections amongst these poor families, the women and children, with eggs, with fruits, with vegetables, with all these items which are vanishing from people's diets while they're making adjustments to these reduced incomes. Cash transfers also, while they have not been as successful as the other schemes, cash transfers, the existing cash transfers target some of the most vulnerable and marginalized in our population. So if we look at cash transfers as the social security pensions, the aged, the single women, the disabled, maternity entitlements, these are the cash transfers that we have in place, and these have suffered. For instance, maternity entitlements, we found that only 20% of the women who were eligible for the Pradhan Mantri Matru Vandana Yojana through these 2 years of COVID got all their installments. So, whereas this is supposed to be a universal entitlement under Food Security Act. So, strengthening even existing cash transfer programs, inflation indexing them, the amounts have not increased for many years. This would be the basic minimum, I feel, that could be done. So, just to conclude, that once again, another survey which shows us that the living conditions of the poor are something that have been hurt quite badly over the last 2 years. Also shows that there is some sense of urgency that is required from the central as well as the state governments towards employment and towards social security. And we hope to see more of that. At least as far as PDS goes, we still have 90 million tons grain lying. We have a very good crop and there's going to be procurement again next month. So that is something that can be done quite immediately to expand coverage and to also include other commodities because of the inflation that we are seeing. I think I'll end here and I can come back if there are questions. Thank you.
Thanks very much, Deepa. I have some questions for you which we'll come back to, but first I'd like to ask Mr. Hegde to make his points, then we can come back. Please, Mr. Hegde.
Okay. Thank you, Amit. First of all, thank you, Azim Premji Foundation and Azim Premji University for this wonderful exercise. And along with other civil society organizations, CFAR was also part of this whole process of this, livelihood impact on livelihood exercise across different wards. So I think the documents which we are presenting, and the report which we are presenting today is very 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 important in terms of making our own pathway, both for the government as well as the civil society organization like us, to really plan on have a proper process in, so that the poorest of the poor and particularly the urban poor get access to livelihood and other opportunities. I will visualize this livelihood in terms of in terms of other elements or the thematic areas where other important element is also important in terms of bettering the life of urban poor. Say for example, the health, the social security, and the civic amenities, and food security. As we all know, during the pandemic, there were a lot of difficulties in terms of feeding the poorest of the poor and the vulnerable communities. So the government has announced, of course they have announced PDS, where they have given some basic rice and other things. But as other speakers said, um, in terms of PDS, how many poor people had a ration card? That is the question. Second is the kind of difficulties or the situation they face. Even today, many families are not having their meals a day. So that is the condition where we seen in the urban poor. Second is health. Because of the COVID pandemic, most of the health centers, including primary health centers and the district and taluka hospitals, they were busy in treating the COVID COVID patients. But what about other people who are facing the comorbidities and the non-communicable diseases? So, and the senior citizens, pregnant, children. So I think health sector is also important to come up with some other strategy to reach urban poor or the poorest of the poor. In terms of social security, as we all know, even in the report we are saying the central as well as the state program were not reaching the real beneficiaries. So there were people. I mean, the revenue department has this very important social security program of pension schemes for the senior citizens, widows, and so on. So, but now after the post pandemic, the Department of Revenue has come up with the order saying that all the senior citizens should submit their living certificate to continue their pension. So that is the situation where we are in. PDS it is real problem. So in terms of livelihood, as we all know, people lost their job. People, many migrants. The people, I mean, CFAR is mostly working with construction workers from North Karnataka. They just lost the job, particularly the construction workers. They have to go different parts of Bangalore to get the jobs. So added to that, many children, the construction workers, children started working in the construction sites, because of the education system. So I mean, even the education sector is also very critical in terms of reaching the children who dropped out from the school or lost their education. So secondly, the department, for example, in the first wave, the Department of Labor has said they will have some provision for construction workers, cash transfer. But in terms of data, the department had no clear-cut picture about how many construction workers are there. So the people who were registered in the board got some benefits. But what about others? People, I mean, the construction workers and other sectors who are not registered in the board were not left out from the surveys. And I mean, that is what is the issue of not having particular or the correct data of the different communities. Other part is skill development trainings. We all know that different departments have come up with different livelihood or skill trainings. But in the urban context, when you introduce any skill program, so the majority of the families are headed by women, and they are the key bread earner in the family. So if you introduce the skills, you ask them for the 2 months training, how can you expect the women to come and attend the program? So I mean, they have to feed the family. So I think strategy wise, we should have different strategy in the urban context to to introduce, or you want to improve the life of urban communities, particularly women. So strategies should be improvised, so that the sector, they have to give the training, and there should be some additional or alternate livelihood for those women. So other thing is, as the study was telling, that the convergent action plans. So we have covered livelihood and some bit of food security schemes. But most of the time, what is happening is, the department wise also, there is no there is a lack of convergence among different departments. So for example, one department who is catering one service to the poor doesn't know what is happening in the other department. So the intersectoral departments, or convergent action should be taken, so that the urban poor, or the women, or the women-headed families who are really in need of these kind of services, is able to get the service of different schemes. So I think convergent action is very important at all the levels, at the ground level, and program level, and the policy level. So that schemes and programs should reach the real beneficiaries, and they get benefit out of it. So thank you.
Thank you, Mr. Hegre. I think we unfortunately, our third panelist, Uma Mahadevan, is not able to make it. She's stuck in meetings. So we'll be wrapping up soon. If there are any questions, please put them in the comment box. One question I had for you, Deepa, was, this is now, we've been doing a lot of these different surveys. You've also done quite a few. And of course, the distress picture is clear. But as far as the safety net part goes, we've repeatedly found that cash transfers are far less effective, whether at the state or the national level, than direct support, let's say in the form of PDS and, of course, MG Narega. So would you say that, what is your thinking? Is there place going forward in the safety net architecture? Is there a place for cash transfers? Should we largely be thinking of food plus work type of situation? And if we are thinking of cash transfers, what do we need to do to make clearly what is a very, very inadequate infrastructure better?
I think it is food plus work plus cash transfers. The problem with cash transfers has been, when we use the cash transfers term pre-COVID in India, it's always come up as a substitute to PDS or to Narega. So that's not what I'm saying at all. But there's certain kinds of things which have to be done through cash, like old age pensions, given that most of the workers in our country are in the informal sector and they're not included in any kind of a pension scheme. We need to have something for the old people. And when the PUCL right to food case was going on and the Supreme Court commissioners were there, we did a number of studies looking at the old age pensions, and we did find that even that 250 rupees was the only cash that these old people had. So even if they managed to get some antodaya or they had children who were feeding them, this 200 rupees was what was giving them access to medicines and even a lot of dignity, to be able to buy even a toffee to your grandchild was something they were able to do just because of this small pension that they got. Similarly, with maternity entitlements, with more than 90% of women working again in the informal sector without any identified employer, we have to think of other ways of providing these kind of social security, and cash seems to be the way to do it. I think one of the reasons it's become so difficult to deliver cash also is that, and it's quite contradictory, is the technology. But because we've got so stuck on using the technology that sometimes the more old-fashioned ways work better. Like when in Odisha they were giving cash as cash in the panchayat on a fixed day in front of everyone each month, the old age pensions were reaching quite well. In Tamil Nadu, when the Narega wages were giving in the form of cash through the panchayats, they were reaching on time and they were working quite well. So maybe this thing of, it's good to use technology, but not getting stuck with saying that technology or what is more modern technology is always better. Sometimes it is not able to solve the problem, or maybe it takes longer. So I feel that is where the cash is actually failing in the access to the banks, and in this thing of having every cash transfer has to be a DBT, which is Aadhaar linked, is actually causing more exclusions than bringing people in. So if you're a little more flexible there, and if the objective actually is that the cash has to reach the persons one way or the other, we might come up with more different kinds of models of reaching the cash, which would then work.
Right. Yeah, I think that makes a lot of sense. So I should have clarified that what I was talking about was sort of these big transfers that are general transfers. So they are not targeted to old age. They're not old age pensions or maternity entitlements, but rather if something like COVID, but hopefully not something as large, but whatever were to happen, you were carrying out a general transfer. What would that look like? Right? Or should it just be something like PDS and Narega, which we know work well, to deliver support?
Yeah. So
Yeah.
even during COVID, we have been through various kinds of collective exercises on seeing what kind of response needs to be there. And the general overwhelming feeling was that PDS and Narega, yes, but that's not enough. There was still a felt need for some amount of cash as well, because there's no cash coming in, and the PDS is not giving you everything you need. Our health system is not one where you get access to free healthcare. Similarly, education. So, not as maybe a permanent program, but these 2 years definitely needed a cash boost also coming in. Probably it's still not too late for that, given the fact that the economy is not yet recovering as much. So, there again, to think of the broadest list that one can have,
Right.
using the PDS and the Narega lists only, maybe, and then adding on all your pension and so on would reach a larger set of people than this Jandan women
Right.
accounts.
Right. Thanks. And then one question for Mr. Hegde. I think you made several good points, including the one about convergence. But really, my question to you, since you are at the forefront of uh, both field-based work and advocacy for what government should be doing and so on, why do you think that we have this very much an ongoing crisis, which has somehow not translated into adequate realization, let me put it this way, at the maybe at the center, but also at the state, and the state governments are supposed to be much closer to the people also, so they're supposed to have much better sense of what is going on. And we are talking about Bangalore, which is the capital of Karnataka. What more do you think can be done to get the true sense of the problems and the crisis, to policymakers? Were you able to hear me?
Of course.
So, any thoughts on
Yeah,
what?
I didn't. One is, of course, as I mentioned in my presentation, that the convergent action should be there. Second is, from all these years, in our experience, many departments works in their own programs. But in terms of data and data management, each department has their own data. For example, women and child, they are supposed to collect the information of women and child, in the sense whatever the programs they are meant to deliver. So they don't have other information about the household. So what we are trying to do is, we need to have a household database, so that each department can work work with each other. For example, now we will try to bring both health and ICDS nutrition together. We work both at the primary health centers as well as ICDS centers, so that the beneficiaries, whoever is registered in the ICDS center, should go to primary health center for the service, and the ASHA workers or the primary health centers, whoever is reached out to, should be go to ICDS center, so that they work together, and services, delivery is also easy, and they can reach the beneficiaries, or the applicant in such a way that both the department services are reaching the beneficiaries. That is what I feel.
Thanks, Mr. Hegde. I think Gaurav had either a point or a question to make. Gaurav, please go ahead. And
Yes, thank you, Amit. Amit, one is basically a comment on what Deepa mentioned, during her comments, that rice alone doesn't help, and we had this, like Amit mentioned, we had a physical, offline event in Bangalore last week where we shared these key findings, and we did have a couple of community representatives as well from from a couple of communities that we had surveyed, and they were very emphatic in their expression of the need to have more supplements as well, and grains alone, rice alone does not help. uh, you know uh, Provision of salt, provision of oil, etc., all of that goes into cooking, and you know clearly your comments connect with what even the communities have been feeling and wanting to express. So that's something that came out really well in the physical event that we did last week. The question I have to both of you, both our panelists, is basically on the impact of COVID on women specifically. You know, in your work, what is your impression of how have lives of women changed, in terms of the pressure to work, the pressure to balance things, and the pressure to earn, now that men may have possibly lost employment more than women would have, given their low participation rates earlier. uh, just very briefly, if both of you could comment on, through your work, what is your experience of uh, women's lives during and post COVID now?
Should I go first? Or
Yes.
Yeah.
uh,
Yes.
yeah. So again, on women's life, a lot of people have been writing about it also. There has been a gendered impact of the pandemic across class and much more amongst poor women. One set was, of course, the period where people were working from home, which resulted in higher levels of unpaid care burdens on women. But along with that, the other things that you do see is that the employment effect has been slightly different on women than from men, which again, even your State of Working India report shows, and other reports also find that the women lost more jobs, and in the recovery, the number of women who lost jobs who've been able to find jobs have been fewer than men. In urban areas, if you look at, for instance, during the COVID pandemic, I've mostly been able to work only in Delhi, and we find that women who were involved in domestic work, for instance, were the ones who were really badly hit, and that's a huge group of working women in Delhi. And it was very uncertain during the lockdowns. They were removed and then they had to go back, and you also find that when they go back, they're going back at much lower levels of pay. At the same time, there are many more women now willing to work as domestic workers because of what you were saying. that the overall household incomes have gone down. So there is a pressure for women to work, but there are very few opportunities available, fewer opportunities for women than for men. Even for men, it's really not enough, the number of jobs we have, but the kind of jobs that women are able to do in our country, given their unpaid work burdens, given the fact that women are not able to travel very far away from where they live, most women, for work. So the choice set of what kind of jobs they're able to do are very few, and those now there are many more women, at least in urban areas, looking to do those jobs. So we see that really in Delhi, the desperation for finding some work or the other. Another aspect also, which I thought was kind of something that needs to be brought out, that we found in another study that we were doing, looking at essential workers during COVID, was that a large actually segment of essential workers are women, not just health workers, community health workers, nurses, and so on, but also sanitation workers, garbage collectors, the sweepers on the roads, and so on. So there are many women who work in these roles, which were essential work in the sense that this was work which was allowed throughout, even when lockdowns were going on. Even those women who kept their jobs, one found that had a much greater pressure on them because their spouses lost jobs. So these are very low paying jobs. Even ASHA workers, for instance, a number of ASHA workers we interviewed, other than the increased burden on them and the fact that they've always been in low paying jobs, now the added burden that they were the sole breadwinners in the family, and their incomes, which were kind of this add on, became the main income. So that pressure was also much more in a work environment where the work was less, more risky. They had no option of actually leaving that job at all. It really became what would carry the family forward, and along with the stress of feeding the household, children not going to school, all of that, which across the country has been felt. We don't have data, but I mean, there are reports of domestic violence increasing and so on. But I think this directly one can see the impact on employment, on the pressure on women to be providers in multiple ways, which they in paid and unpaid, is something that COVID has definitely done, and we still don't see any gendered response in terms of the policies that are coming up, other than cheaper loans maybe to SHGs and MSMEs and so on. But otherwise, that's a huge big gap. So it is a question that we need to keep asking.
Thank you.
I think my first response is women reduced their, 3 meals a day into 2 meals, or they just, feed the family. Just impression, because we have few case studies, of which I'll just share one of the case studies. Women who have 4 children and old age parents. She's the only woman who go for work, domestic work, and she's just having 1 meal a day. That is the situation. Even right, I mean, even now the situation has not been changed. So in the urban poor, we find so many women like such women. So second is with regards to women working in the garment factories. There are so many garment factories are closed or moved to other places. So I think before COVID, they used to get piecework at home, and they are managing to look after the children, and I mean, they earn something. But now because of shifting or closed down, they lost job. So I think it's not just one sector; all the sectors, domestic workers, 100%. Majority of them are women, and garment workers. In fact, street vendors and Aurakarmikas or the sanitation workers. So I think in the urban context, if you really see the life, I think most of the families are women-headed, and they are really, impacted a lot in terms of livelihood and other opportunities.
Thank you so much.
Thank you. So I think we'll wrap up now. We're almost out of time also. So thank you very much, Deepa and Hegde, for joining us. And we'll be, for those who view this later on also, we've posted the list, the link in the chat box, which where we'll be archiving various things that come out of the survey. Right now, we have the basic findings that we presented today that are put up there. But in due course, we will also be putting out a more detailed report, which will be put up as well as any other materials. And feel free to please reach out to us as well if you have any questions. Our email address is csc@apu.edu.in. This is the Center for Sustainable Employment at Azim Premji University. And thank you very much again for all the panelists and the viewers. Have a good day.
Thank you.
Thank you.
Thank you.